Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with an outer ear infection and more specifically a condition called swimmer's ear. Swimmer's ear is an infection of the ear very commonly found in people that go swimming, hence the name, and that's due to water getting lodged into the ear and then promoting bacterial or fungal growth within the ear canal. If you've been watching my videos, you would know that I'm always advocating against allowing water entering your ear. It's what I describe as the Kryptonite of the ear. It's not good for you. Growing up, no one ever explained this to me. It was nothing that I was aware of, but once I became an audiologist, and more specifically when I started working close with ENT and performing clinical ear care, we should see more and more cases of swimmer's ear and other sorts of ear infections, primarily as a result of water entering the ear. This patient did get water in the ear. They've had this chronic discharge for a while. They've had antibiotic treatment. It is a Pseudomonas bacterial infection. They've had it swabbed, but it's just prolonged. They've tried many different types of antibiotics, but it's quite resistant, this infection. They have got an appointment with ENT to have this cleaned. Not everyone performs clinical ear care on infected ears, so this patient found me on YouTube and travelled to see me at my clinic in Leicester, which is in the Midlands in the UK. The entrance of the ear, you won't have seen it right at the beginning of the video. It's really inflamed, and I couldn't, in the first instance, get the suction probe into the ear because it was so inflamed. Nonetheless, I managed to stretch the patient's ear open, and I'm now using a fine end suction gauge probe, so it's a bit thinner, and I can get access. You can see I'm stretching the ear open, and this is a technique that I train in our earwax courses. You would have seen a video yesterday entitled Diarrhea Earwax Removal, and that was of a case that was referred to me by another local audiologist. The patient had really narrow mid-canal, so the entrance and the medial part of the ear canal wasn't too bad, but the middle section of the ear is really narrow, and the audiologist wasn't able to gain access in the ear as a result. They were using a different visualization technique than an endoscope, and you can just see how effective an endoscope is, even in the most narrow, twisty, bendy ears, once you've acquired the correct skill level, and that's something that I train delegates to do. You're able to perform endoscopic clinical ear care in in any ear, regardless of how narrow, twisty, bendy, small, large it is. Again, I've just stretched the ear open, just using, as I said, just going to be suctioning all this discharge. The ear already looks a whole lot better than when the patient first attended. One of the secrets with an ear infection, and this is I learnt this through my time working very closely with an ENT, a very highly regarded ENT and lovely gentleman called Mr Rajali. I used to do a lot of ear clinics with him privately, and we would treat a lot of infections, and one of the advice he gave me is, wherever possible, when it's safe and you're not going to be compromising patient safety or care, is that if they've got an infection, try and get as much debris out as much as possible. That'll not only helps the patient when they're using any ointments or drops in the ear to fight the infection, but by getting the ears dry as possible can really help. That alone itself can help stop the bacteria from sometimes reproducing. That they might need a few appointments. So if we left this earring, so what we're doing today, we're clearing the discharge and the dead skin that's lining the ear canal and the eardrum. Now, if we were to just leave this ear without the patient using any medication, it's very likely that all this discharge infection will come back. But over a period of time, if you regularly clean it, it can get on top of it, or definitely assist, I would say. So it's not the silver bullet, but it will definitely assist when using any sort of ointments. So you can see the eardrum's fully visible. It is quite inflamed in there. They have got an upcoming appointment with the ENT. Hopefully they can prescribe or apply some topical cream within the ear to help this infection. And we're just gently hovering over the canal. Don't want to make any contact because that would be uncomfortable. So one of the symptoms of swimmer's ear infection is tenderness, swelling, pain in the ear. We don't want to add to that. The patient's already come here today with pain. As you can see, the entrance, as I mentioned right at the beginning, was inflamed. But I just want to get a bit more dead skin off on the both on the superior canal wall, so the top part of the ear canal, and also there's a bit here on the eardrum. Now again, if I was clear wax delegates, I would advise them to just not to worry about this until they've gained a lot more experience and skills. Not something that you would do this as a beginner or someone who's just qualified. You need a lot of experience, you need a steady hand as well, because we're right on the eardrum here, and you can just see the view offered by the eye clear scope. So yeah, swimmer's ear, it's an infection caused by water entering the ear. Many reasons. It could be bacteria within the water. Water can also wash away the natural acidity in the ear, which then allows bacteria and fungal to thrive in that non-acidic environment. So it's very important you avoid water. How do you do that? So the easiest way is to obviously naturally just don't purposely get water in your ear. So I know a lot of people have got habits, a lot of clients of swimmers ear, they get the shower head and put it in their ear, or they purposely position their head under the water so water can get into the ear. Avoid that. You can get swim plugs over the counter, some foam or silicone ones, or some putty even. A simple thing with a cotton wool with a bit of Vaseline, not in your ear, just at the entrance, so you kind of almost shut the entrance. That can also help provide a watertight seal. There are some sprays available on the market which helps repel water from being absorbed within the ear canal, so it just drains away. A swim headband, that's another tool, another avenue you may want to explore to avoid water. But so whether it's showering or bathing or swimming, you really want to limit the amount of water that enters your ear. So that's the patient's eardrum. Just having a quick look around. So if you kind of rewind right to the beginning of the video, and you can remind yourself the difference of how this ear now looks. I think I'm just going to be mopping up near the entrance here. Bit of dead skin, keratin. So this is the cartilaginous portion. We can put a bit more pressure here. It's not going to be uncomfortable for the patient. Well, I hope you enjoyed that video, guys. Take care and speak soon, and look after yourselves. Bye.